Dr. Diane Hudson-Barr is here to talk with us about research, and I'd like to begin, Diane, by asking you two questions. What are the steps in the research process, and how does the Nursing Research Council fit into that?
Well, the most important part of the research process is to come up with a question that interests you, so something you're curious about in terms of the way that you practice. And then you contact the Nursing Research Council, either with private consultations with members who've done research, or you actually get onto the website and get the proposal process. You develop a proposal, then you come to the Nursing Research Council and present that proposal, and then we send you a letter of approval, and after that point, you'll have to go through human subjects protection, and then you start the study, collect your data, analyze it, and then finish it, and then publish and present your findings.
What's a typical time frame for a nursing research project?
Well, it really depends on what topic you pick to examine. I've seen research studies be done in a couple of months when it's something that's pretty straightforward and you have a lot of patients or a lot of staff that you're able to talk to. But I've also seen it take years and years, depending. I worked on studies where we looked at babies from being born premature to being 4 years of age. So it really depends on what topic that you pick.
What are some of the examples of nursing research that have been done here at UNC?
Well, as you heard earlier with Tracy, the SAGE project was one of the I think one of the most significant studies that's been completed here. And also there's a publication as well, as Tracy had mentioned. Chris McGrath from the Carolina Air Care did a study where he looked at STEMI patients, so ST elevated MI patients, and looking at how long it took from once they were picked up by the air care team to get to the cath lab. And so he was doing some retrospective looking. Afshin Maimandi has done several studies looking at the use of a retreat room instead of putting patients in seclusion that are on the psychiatric service. And Darla Topley, who's from the SICU and Trauma Center, has designed a study looking at ambulation in ventilated patients.
Thank you so much, Diane. I really appreciate your time. And now we're going to be talking with Leslie Johnson. Leslie was the first staff nurse chair of our Quality Council. What do you think was the single greatest accomplishment of your Quality Council last year?
Well, in all of our meetings, we really started to realize that quality encompassed a large volume of information that staff nurses on each unit were responsible for knowing. Everything from joint commission readiness and core measures to you've got the work that's going on all the committees like falls and skin, pain, restraint, and NPI. So a couple of our nurses developed brochures, and we took those brochures to the unit on a roadshow format.
So NPI would be Nursing Performance Improvement?
Yes, correct.
Okay, so how were those roadshows received?
The reception was overwhelmingly positive. Nurses liked that we came to them. It gave them a chance to ask questions of us and bring up issues that we could then take back to the council. So it really showed them how shared governance works for them. It reinforced the idea of shared governance giving them a voice.
So what's coming up for the Quality Council in 2010?
Well, we have our next round of roadshows next month in March, and it will be the first roadshows for some of our new reps who just rotated onto the council, so we're excited to include them. We wrote an article entitled Communicating Quality via Roadshows, and that was published in the current issue of Journal of Nursing Care Quality.
Congratulations.
Thank you. For the council this year, we're working on developing quality at the unit level, including developing G-charts for falls.
Can you tell me what a G-chart is?
A G-chart is a simple display that would say like how many days since the last fall on this unit.
I remember now. We use those with VAPs, or ventilator-associated pneumonias, in the cardiac intensive care unit.
Yes.
Well, thank you, Leslie. That was really great. And thank you for joining us for this discussion about leadership at UNC Hospitals. And remember to stay tuned, because I'll be coming to a unit near you soon. And until then, make it a great day.